Aster Aadhar Hospital is one of the leading hospitals in Western Maharashtra. Since last many years, millions of patients are served with utmost care and compassion. We have made all super specialty care available at Kolhapur region itself. With an intention to serve many more patients and to make super specialty care even better at Kolhapur, we have started a new facility. For radiation oncology, we have got 100% image-guided radiotherapy treatment, which enables consistent and confident workflow. It can give smaller tumors margins, leading to increase in cure rate. As it is 100% IGRT, there are no chances of giving the wrong treatment to the patient. Setting up time for the patient on the machine is very less. This machine is loaded with artificial intelligence, which helps in correct planning, imaging and treatment. This machine has got 4 RPM as a gantry speed, which makes it very fast and at the same time very accurate as well. Patient spends less time on the machine, which also means he'll be exposed less to the radiation. Operation theatres in new facility are designed with the global standards, and they can cater to wide range of procedures, including all kinds of organ transplant. We have received first liver transplant license in the region, and soon we will be transplanting not just organs but new hopes too. With stricter infection control practices and adherence to the quality, new operation theatres are one of the benchmarks in clinical care. Moving in the new facility, we have an advanced cath lab, Philips Azurion 3F15. This cath lab gives coronary roadmap, where one image is taken after the contrast administration, it is stored and later superimposed on the live view. Hence, there is no need for the repeated dye insertion and lesser chances for kidney injury. Image quality of the cath lab is clear, and in live view, cardiologists can see if the stent is open properly or not, or if the stent is in proper place or not. Algorithms such as stent enhancement are there in this cath lab, where during the angioplasty, stent deployment is viewed very clearly, leading to the precision in the treatment. Modern treatment modalities such as intravascular shockwave lithotripsy, intravascular ultrasound are integrated in this cath lab. C-arm of this cath lab moves up to 360 degrees, which makes rotational angiography possible. It also takes wide-angle pictures, leading to crystal clear clarity in images. We have a separate dedicated floor for pediatrics, in which we have 13 NICU and 8 PICU beds. Separate and dedicated team of doctors, nurses, caregivers who have extensive experience makes this department a promising one in pediatric care at Kolhapur region. Brachytherapy. Brachytherapy is mainly used for the treatment of cervical cancers in females. Almost 50% of the cancers found in female are cervical cancers. Treatment on linear accelerators for such cancers are only 50% effective. While to have a complete treatment, brachytherapy is absolutely essential. Along with cervical cancer, we can effectively treat head and neck cancers, breast cancers, as well as prostate cancers. Implant brachytherapy can also be performed, which makes radiation department a complete department at Aster Aadhar. As we move towards main lobby, patient pathways are well defined. Bone marrow transplant is a dedicated department at Aster Aadhar, where all kinds of bone marrow transplants are performed. We have dedicated rooms for BMT patients and trained and experienced doctors who perform bone marrow transplants regularly. For over 3 decades, hospital is well known for high-risk pregnancy cases. Now we have a dedicated IVF department with a trained and experienced team. With these new additions, Aster Aadhar is poised to make a difference in the lives of millions of people. At last, we will always live up to our brand promise, we'll treat you well.